Andropause. A middle-aged couple approached me. The husband is around 55 years old. The wife is around 50. The wife complained, "Doctor, of late, my husband is behaving very differently. Normally, an easygoing and calm person. Nowadays, he is irritable, restless, and gets easily upset. Not only that, since past 2 years, he has lost interest in sex with me. Will you please examine him and find out what may be the problem and treat him accordingly?" I looked at the man. He looked very confused. Even though he denied nothing is wrong with him, he agreed that he is becoming irritable of late. The problem which is being faced by this gentleman is known as andropause. This is something similar to the menopause in the woman. Andropause is the term used colloquially for men who are going through the same symptoms as menopause. In medical parlance, it is called the late onset hypogonadism. In other words, the cause of the gentleman's problem is a deficiency in testosterone. Now somebody might ask me, "Doctor, I thought that testosterone is only necessary for sexual vigor, sexual potency. But here is a person who is irritable, lost interest in sex and other things." Agreed. We make a mistake of thinking testosterone is only for male virility. No, sir. Testosterone has got a host of responsibilities. It is responsible for many actions in our body. It builds our bodies, muscles, it gives strength to our bones, it regulates our moods, etc. etc. The point is, in a woman's menopause, there is a sudden decline or stopping of the female hormone, estrogen. So it is very clear cut. The periods stop, everybody knows. But in a man, it's a very slow process. Testosterone peaks at around the age of 20. Between 20 and 40, the testosterone levels are maintained in the body. After 40, there is a gradual decline in the production of the hormone in the male body. Approximately 1% reduction for every year of life. That means whatever problems faced by the woman due to her menopause is also faced by the man, except the stoppage of periods, but not suddenly, in a very slow manner. This decline starts around 40 and goes up to 70 and more. People who have a deficiency of testosterone, the first thing they notice is they start losing interest in sex. The body mass is reduced. The muscle mass is reduced, called sarcopenia. The bones become brittle. Abdominal fat starts accumulating, central abdomen. A man who has been otherwise bold, he starts losing confidence in himself. He becomes irritable, restless, listless, goes into panic or becomes afraid quite easily. Earlier, even a major thing cannot affect him that much. But here, a small obstacle may push him into a panic mode. He may stop forgetting things. These are all symptoms of andropause. His mood also declines. He may start slowly slipping into depression, anxiety and depression. There is no point in just treating the symptom. For example, the man is depressed. Putting on antidepressants alone is not sufficient. What is important is to treat the root cause, which is the deficiency of testosterone. Body hair is lost. Facial hair is reduced. The hair on the scalp becomes less. The muscles which have been taut earlier become loosened and hang around. If you see elderly men with their shirt or banyan on, like what you see in kacheris, we find that their male breasts are developed and they are hanging like an elderly woman. Agreed, this is a part of aging process. I am not denying that. But since our life expectancy is growing, like 40 for a male in the year 1950 to 71.6 now around 2020, at 40 he starts losing testosterone slowly. By 70, deficiency is very significant. And he develops all these symptoms. And he requires help from healthcare professionals. Now, these people can be helped with testosterone replacement therapy, provided there is no contraindications. There are certain conditions like prostate gland enlargement and other blood-borne diseases, in which case we cannot put him on testosterone replacement. Once you rule out this, the person does not have this. The ideal thing is to replace him with testosterone supplements. Testosterone can be given orally in the form of capsules, or it can be given through injection forms. It can be given through testosterone patches or sublingual suppositories, that is below the tongue. You keep the suppository under the tongue. Now a question may arise. Doctor, suppose this gentleman has got a contraindication. You cannot put him on testosterone. And what else can be done? Yes, there are alternatives. Ayurveda very clearly tells equal proportions of black gram powder, honey and ghee. They are useful to boost testosterone levels in an aging person. In fact, the chemical nature, the molecular structure of black gram is found to be similar to that of a testosterone molecule. Apart from this, exercises like Surya Namaskar will help boost testosterone production, will stimulate. If you look at the yoga textbooks and proponents of yoga, they very clearly tell that our endocrine system, that is the hormone system, can be stimulated by yogic asanas. So Surya Namaskar is a very good yogic asana which will stimulate the testes to produce more testosterone. Green leafy vegetables will boost testosterone levels. A question may come, Doctor, if it is going to be a natural aging process, why should we interfere medically and treat it? Agreed. A child or a man has got a birth defect in the heart, in the abdomen, or somebody got blood cancer. Can we keep quiet saying, is the nature's way of eliminating the sick and making the dictum survival of the fittest? Can we keep quiet? No, sir. That is inhuman. It is inherent to us that we have to help people who are suffering. By doing a coronary artery bypass graft, a heart surgery, we are helping the person suffering from heart problem be free of heart problems. Can we apply the same yardstick there? Can we operate on a small child and help her to live longer than allow her to die? It is not human nature. Human nature is to help people who have problems and who suffer. So, managing an aging process is a good healthcare policy. We need not feel bad about it or shy about it. What we are trying to do is not just prolong the life. We don't want to add years to life, but rather we would like to improve life to the years. In other words, our objective here in hormone replacement therapy and management of andropause is to improve the quality of an aging man's life.